A very good morning to you all. Thank you for joining today. 12th of October is indeed EU Flu Day 2022. So I appreciate you all joining us today. Now, today we are going to be talking about how to make influenza vaccination a priority across Europe, but in particular also looking at those high-risk groups. We're going to be taking stock of what can be done at a policy level, whether that would be EU, national, or even local. We'll take a look at that and the recommendations. And of course, bearing in mind the reduction and the fallout from the COVID-19 pandemic. So this is a very timely event because, of course, we're looking ahead to what could be a difficult winter for other socioeconomic reasons as well. So a lot of things to cover. Today, we are going to be recorded, so please be aware of that if you're joining. We are also going to ask you to share on social media the news that this is a big day. It's hashtag EU Flu Day to spread the word about getting vaccinated. Please do share that online, give us your thoughts, your comments, and also get your other colleagues who perhaps haven't time to tune in today involved to share that message as well. We have some remarks. We also have a keynote presentation, and then we will go into the panel discussion. My name's Jennifer Baker. I'm an EU policy journalist and I will be your moderator today. And I do want to get as many of your questions as possible to our panelists. So please use the Q&A function. You will see that at the bottom of the screen. It's a small voice icon. There's also a chat function as well, but we'll allow that for chat or for more personal issues to say hello to your colleagues, but we will mainly focus on the Q&A for those questions. If you can make the questions concise, that would be very helpful. And if they're directed to a specific panelist, please do say so. Now, today we have members of the steering group joining us. They're not listed in our panel, but there are many of them joining. So they will perhaps be able to jump in if you have specific questions. There's a long list of organizations, too many to mention, but of course we do have, I know, Vaccines Europe, among others, joining us online because today's event is organized by the steering group on influenza vaccination. So members of that group really are here to have a good conversation and really help out with the questions. Now, we're joining completely online, so the good thing about that means that we can deal with more people across Europe without having to meet in presence, but it is under the auspices of the European Parliament, and we have now MEP Dolores Montserrat, who is co-chair of the steering group of influenza vaccination, to set the scene for us today. Thank you very much. The floor is yours.
Thank you very much. Good morning to all the participants. Thank you for the introduction and to the steering group on influenza vaccination for organizing this webinar today. As a member of the European Parliament, particularly aware of the importance of flu vaccination, I'm delighted to be hosting this important event marking the European Union Flu Day 2022. I'm happy to see so many of you here with us today as we come together for the third year in a row to highlight the threat that influenza poses to people and health systems and the need for action. In the 2021-2022 flu season, measures taken to prevent the spread of COVID-19, such as social distancing, hand hygiene, and use of masks, led to flu not circulating as much as in normal circumstances. The picture is looking quite different for this upcoming season, with the COVID-19 restrictions lifted and people finally being able to interact with each other again. Now influenza spreads much more than it did in the past couple of years. We are already seeing concerning evidence in the Southern Hemisphere, with Australia recording more than 65,000 confirmed influenza cases in May, more than double the month's previous record. Adding to this threat, it's the lower attention to influenza from politicians as well as media, which is why it is so important to talk about influenza as we are doing today. Unfortunately, due to the lack of a timely monitoring system of influenza vaccination coverage rates in Europe, There is no way for policymakers to assess the urgency of the current situation in real time. There is also no robust way of comparing data between seasons, regions, or countries. Still, we know that there are many good practices to ensure that populations are protected. For example, in last year's seasons, Spain recommended the flu jab to the entire population rather than only risk groups. Other countries decide to extend the influenza vaccination campaign and try to promote convenience by recommending vulnerable people to get the flu and the COVID-19 vaccine on the same day. It has also been important to consider vaccination for children, with students back to school and easily spreading the virus. As you know, in 2029, the European Union reiterated the WHO's 75 target for flu vaccination coverage among at-risk groups and health workers. This target was set to guide member states in better protecting their populations from season flu. Sadly, more than 10 years later, we are still very far from this target. The average coverage rate is only 41.4 in the European Union, with Spain at 54, but no country meeting the 75 percentage level. Still, I'm convinced that more can be done to get there. The COVID-19 vaccination campaign is a perfect example of the strength of European Union collaboration. Through such cooperation and dialogue, and I believe we can achieve great things also when it comes to flu vaccination. We need to use the lessons learned from COVID-19 when it comes to monitoring and surveillance of vaccination coverage rates at regional level. The European Union can also help share best practices between countries, drive educational initiatives, including for health professionals, and encourage member states to facilitate better access to flu vaccination. The title of today's event is Making Influenza Vaccination a Priority Across Europe. This captures the core message I want to convey to policy makers today. Flu is a real public health threat, and it needs to be prioritized accordingly. Member states need to act, but we also need an European Union approach since viruses know no borders. I'm very happy to be part of this platform, which brings together such a variety of stakeholders with one common mission: creating real change towards higher flu vaccination uptake. I encourage my colleagues in the European Parliament to help amplify the European Union Flu Day campaign to ensure it reaches capitals and citizens in all member states. And I call on the European Commission to take the recommendations we will be discussing today into account and lead the way towards higher flu vaccination uptake in Europe. I will now hand back over to our moderator, and I'm looking forward to hearing from our speakers as well as everyone in the audience. Thank you so much. And I think that today is an important day for all the European citizens.
Thank you. I think you taking time out of your busy schedule really reflects the importance of it. And as you said, it is differing from region to region. We know that the World Health Organization targets about 75% for at-risk groups and healthcare professionals, but it varies hugely across the EU. Some are meeting that target, but some are as low as 20%, meaning that it's around about 40% overall across Europe. So I know this is something we're going to work on. So thank you very much, MEP Dolores Montserrat, today.
Thank you.
We're going to turn now to a presentation on the impact of influenza on at-risk groups. And to do that, I'm pleased to welcome Susanna Palkkonen from the European Federation of Allergy and Airways Diseases Patient Associations. Thank you very much, Susanna. I know you're going to give us some real practical information and some real messaging about at-risk groups. So I will hand the floor over to you.
Thank you very much, Jennifer, and thank you, Mrs. Montserrat, for those encouraging words. I have the pleasure to talk to you today. Let me just share my screen here. Great. I am coming from European Federation of Allergy and Airways Diseases Patients Associations, and we are advocating change for all people with allergies and airways diseases. And these groups are actually some of the highest high-risk groups for influenza. And that is why it's important to talk about them today. So what is the real impact that we are talking about on people with the respiratory diseases? In fact, as an organization, we are 46 allergy, asthma, and COPD patient groups in 26 European countries. Asthma is the biggest chronic disease in children, and COPD, chronic obstructive pulmonary disease, is today the 4th leading cause of death, and it is due to become the 3rd leading cause. It is estimated that 10% of adults in the EU who are over age of 40 have COPD, whereas food allergy and atopic eczema have one of the biggest impacts on the quality of life of families and patients. And the impact of respiratory allergy in daily life is underestimated completely. The patients that IFA is representing, our health depends on prevention. And that is why we work on 3 pillars: inform, prevent, and care. And influenza has impact on all of these pillars, including the care. And I will explain you later how. In fact, the European Centre for Disease Control and Prevention defines that there are 2 risk groups where routine annual immunization with the seasonal influenza vaccine is justifiable on scientific and public health grounds in Europe. And these 2 groups are older age groups and people with chronic medical conditions, and especially those with the chronic respiratory diseases. What are we talking about then when we think about asthma, COPD, and lung disease in general? If you have asthma and you catch influenza, it can cause inflammation in your lungs. It can cause asthma attacks or your asthma symptoms to get worse. And that is really no joke at all when you have asthma. You are at higher risk to develop pneumonia or other acute respiratory diseases than influenza. In fact, 80% of acute exacerbations of asthma are caused by viral respiratory infections. And in the US, where we have data from, we don't have the same data from the EU. Asthma is the most common medical condition among children who are hospitalized because of in the flu season, and one of the most common in adults who are hospitalized with flu. When it comes to COPD, if you are more likely to catch respiratory infections such as influenza in general when you have COPD. And among those patients who are hospitalized with the acute respiratory disease during the flu epidemic, COPD is the most common underlying disease. When you catch influenza, you are at risk of acute exacerbation of COPD, and exacerbation of COPD is always serious, and it can lead to permanent decline of your disease in general. With the if you have COPD, you are at increased risk of hospitalization for influenza if you have it. For lung disease in general, it is the most important risk factor if you catch influenza to get a adverse and poor outcome after the infection. There is a significant hidden and personal impact on patients for catching influenza that is not measured by anyone. This is Isabel Saraiva. She is a COPD patient and also a COPD advocate from Portugal. And I specifically asked her to send a message to this webinar, to this flu day. And she says about flu and herself that as a COPD patient, I see flu as a threat that can put my respiratory health, if not my life, in danger. So I start to take special precautions. I avoid closed places with a lot of people, such as shopping centers, concerts, and others. And if I can't avoid, I use a mask, and the same for public transportation. I make an appointment with my doctor for my winter respiratory checkup and my vaccine flu prescription. And as always, and even if the weather is cold or if it's rainy, I exercise every day, I eat healthy food, I try to breathe clean air. Summing up, take good care of your lungs, keep a healthy body, avoid pollution inside and outside, and vaccinate as soon as possible, and never smoke. As you can see, as a patient, you have a lot to do, and not everybody is as informed and as active as Isabel. And we as patients, we do need the structures, the society around us to support for taking up this task. This is, I have two other messages from other organizations that we are working with. This is Dr. Jane Barrett, and she's the Secretary General from the International Federation of Aging. And she wants to convey this message today on the flu day. All people, regardless of their age and medical condition, they have the right to be as healthy as possible. And vaccines are one of the most effective public health actions of our time. So easy access to the influenza vaccines at no cost is essential. Those people who are most at risk of serious and life-threatening complications from vaccine preventable diseases, they must be prioritized. The second message is from Lindsay DeSantis, who is from the Global Allergy and Airways Patients platform, our partner organization globally. She wants to convey today to you on the flu day, patients with asthma, COPD, and other respiratory conditions, they are at the higher risk of complications with the flu. So annual vaccinations, they are important to ensure the best possible protection against the 4 flu viruses that have been identified for most common for this season. As always, it's recommended to consult with the primary doctor or a specialist. Vaccination is protection for yourself, for your family, and your caregivers from complications with the flu viruses. And it is the vital step to ensuring a safe flu season for all. I have some good news, though. At IFA, we conducted a survey called Active Patients Access Care in 2019, before the COVID pandemic, for 770 patients with asthma and COPD in Europe, in 5 countries: Finland, France, Germany, Italy, Poland, Spain, and the UK. And the patients in these countries, they reported, in fact, that they were aware that flu vaccination, largely aware that flu vaccination is a factor that could improve their situation as patients when it comes to prevention. And in fact, they were also of the opinion that the public authorities were largely promoting this. The situation was not perfect, but we were very happy to hear this. As patient organization, we now observe that unfortunately, the lessons learned about communication on vaccination during the COVID-19 and the need for awareness has not translated into change in the communication about influenza. We feel that we have gone a little bit to the business as usual before the pandemic. So we need to wake up. For those who are vulnerable, vaccination is in fact not prevention. It is care, and it needs to be part of your healthcare plan. Public health message will not be enough for the vulnerable groups. Data is key to drive policy and action, and we need real-time good data in Europe regarding influenza also. Thank you very much, and I wish you a good flu day moving forward.
Thank you very much, Susanna, and thank you as well to those patients for sharing their personal stories as well. I think it helps us all remember that there's always a human face behind some of these drives that we talk about in terms of policy and the need for care. We're going to turn now to our panel discussion. So if I could invite my panelists to turn on their cameras, we will say hello. First of all, to Professor Ab Osterhaus, who's chair of the European Scientific Working Group on Influenza and Other Respiratory Viruses, and also a member, of course, of that steering group on influenza vaccination. Professor Adam Antsiak is Vice Chancellor for Clinical Affairs and Scientific Management at the Medical University of Lodz. Dr. Richard Peabody is High Threat Pathogen Team Lead at World Health Organization for Europe. And joining us via phone, we have from the European Commission, Stefan Schreck, who is an advisor for stakeholder relations at DG Santé, the health department within the European Commission. Thank you all very much for joining us today. Of course, because it is so important, I know you wouldn't miss it. But Professor Osterhaus, perhaps I could start with you. Tell us what you think is different about 2022 and what we should be bearing in mind.
Well, I think there is a major difference this year. If we compare it to the previous years, of course, the last 2 years, we had barely any flu. And so we expect influenza to be there again. But the most important thing, I think, at the moment is that it will be coinciding with possible outbreaks of COVID. And so I think the most important message today, I would think, is that all people in the risk groups, and some have already been mentioned, but there are many more, of course, that all people in the risk groups get vaccinated, not only against COVID, but also against influenza. We've seen that the influenza vaccination has come down over the past years. And so my main message today is, if you're in the risk group, get vaccinated. And that is true for the risk groups, but definitely also for healthcare workers. I think it's important there as well. And still, so it's not stressed enough, I think, in Europe, but it's important to have healthcare workers vaccinated, not only against COVID, but also against influenza. And I think one of the first important things for a healthcare worker is not to harm the patient. So taken together, I think the main message at the moment would be, if you're in a risk group or a healthcare worker, get vaccinated against both. That's a very important message. And the other message, of course, if you develop influenza, and we're talking mainly about influenza today, it's not dissimilar from what we see in COVID. If you do get influenza, yeah, go to your doctor, and there's also good antiviral medication. So basically, be quick on the ball. Yeah, first of all, get vaccinated in time. Yeah, and in most European countries, it's being reimbursed. But even if it's not, well, contact your doctor definitely if you're in the risk group to get vaccinated against both. And we know now that vaccination against both COVID and influenza can happen at the same time. So there's many more messages there. But if there's one message I have to stress, it would be about vaccination of risk groups and healthcare workers. Thank you.
Thank you. Very practical advice to kill two birds with one stone and get both vaccinations at the same time. I think it's something that the general public is concerned about whether they can do that. So that's a strong message. Professor Ansack, we're talking about at-risk groups to start. And of course, we mentioned there many of the pathogens, but at-risk groups are, as we've just heard, also those frontline workers, as we've come to know them, those people who are in contact with the hospitals and so on, but also perhaps via age reasons that you could be an at-risk group. How do we reach out to everyone?
Well, the problem is that there are numerous groups that should be vaccinated. I absolutely agree with Ab that vaccination for both influenza and COVID should be taken place. And what we are doing here in Poland nowadays is as loud as possible to give the message that the vaccination against influenza has to be taken. And it has to be taken. It would be very good if it was taken together with COVID-19 vaccination. We have a slightly different situation in Poland compared to Western Europe for the last 3 years, because the numbers of people who took vaccination in the last years against influenza has increased by 300%, which is huge increase. But you have to be aware that we started with a very low levels, because before pandemics, we had only around 4% coverage, which was extremely low and one of the lowest in Europe, including Baltic states, Poland, Bulgaria. It is very low level of vaccination against influenza. Nowadays, it has increased up to between 7 and 10%. We don't have precise data. And what we are really scared about is that the number of people who would vaccinate nowadays this season will drop against influenza compared to the last 2 seasons. So we have a slightly different problems. Anyway, the groups are the same: healthcare workers and those who are at higher risk.
Dr. Peabody, I mentioned at the very beginning some of those World Health Organization targets of 75%. Why not 100% as a target?
Good question. And I think it comes back to the messages that we just heard from Ab and Adam, that vaccination is really the most important intervention we have to protect against severe disease, against hospitalization and death for influenza. But we also know that it's challenging for healthcare systems to get high uptake in priority groups. And uptake in many countries, unfortunately, falls far below that 75% target. So what we feel that, you know, if we can achieve 75% uptake, that would be a fantastic achievement. But clearly, if countries have already done that, and there are 1 or 2 who have reached that goal, then yeah, go the extra distance, try and ensure that everyone is protected. We leave no one behind, because we really want to ensure that everyone is properly protected this winter against flu. And again, just to sort of come back to this messaging that flu has not gone away, because of the pandemic and the response to it. Many countries haven't seen a great deal of flu over the past 2 or 3 years, but now that many people's lives are returning to normal, we're starting to mix again, we're starting to travel, then we are concerned that this winter we may well see quite a busy flu season. And if we look at the Southern Hemisphere and what's happened there, they obviously had quite an early and intense flu season. So we do need to be ready, we do need to be prepared. And of course, the key way you can do that is get yourself vaccinated early so that you're properly protected as we move into the winter period.
Well, I'll bring in our colleague from the European Commission as well. Stefan, we can hear you, I hope, even if we can't see you. We know that health is a member state competency, to use the horrible Brussels phrase, but what can something like the European Commission do? Is it in terms of messaging? Is it in terms of encouraging different health authorities to do their job better?
Yes, thank you very much. I hope you can hear me.
We can indeed.
Can you? Yeah, wonderful. At least the telephone works. Yes, indeed, you're totally right. Healthcare is member states' responsibility. And so what we can do is still support member states in what they are doing. And there is the 2018 Council recommendation on vaccination, which also repeats the 75% target. And we can finance projects that actually help member states implementing the recommendations, the whole list of actions in this council recommendation. And the last one just ended in March this year. And of course, we can also help member states in communication. We are going to launch today a communication campaign together with ECDC and WHO. Because indeed, as I cannot add a lot to what the other panelists have been saying, but what Professor Osterhaus started with, the important thing is to get the risk groups vaccinated, and we should really focus on that.
Well, we're also seeing a couple of questions coming in already from audience members, and they tend to focus on, we've got 3 questions here. First off, asking what is the youngest age of a child who can safely take the flu vaccine? Dr. George Castellanos is asking, has Europe appreciated the importance of vaccinating healthy children as well? And again, another question about how can we increase influenza vaccination rates amongst pregnant women? Those are 3 very sort of specific cases there. Perhaps you'd like to tackle one of those or any of those questions.
Well, I would love to do so, but since Rich is on board and he is a pediatrician by training, and so he's still a pediatrician, I think he's best positioned to answer that question. But perhaps one extra message which I failed to voice so far is that we have to see that at the Southern Hemisphere, when flu and COVID come together in one patient, the situation gets very serious. So again, for those risk groups, I would say it's very important to get vaccinated. And especially if you get the 2 diseases at the same time, the mortality percentage is very high. So I would really stress that again. And then would I like to ask Rich to take the question from the panel, from the audience.
Richard, then these questions regarding children, what age, whether it's advisable for pregnant women. What's your advice there?
Yeah, no, thanks for the question. So if we just take those 2 groups, so in terms of pregnant women, we know that pregnant women are at risk of severe influenza if they are infected during their pregnancy. And the infection can also have a negative impact on the unborn child as well. And vaccination consequently will protect both the mum and the newborn infant. So it's a really important intervention. Many countries have pregnant women as one of their recommended risk groups. And again, we should really be trying to get as higher uptake in this group as possible to protect both the mothers and their children. And then in terms of children themselves, so this is also actually an important group to consider for vaccination. Particularly, we understand that young children, so children under 5, we know are at elevated risk of hospitalization, and so vaccination of them can provide important protection against hospitalization. So both groups important to consider for vaccination. Obviously, in addition, Remember the groups at higher risk of severe disease, the elderly, healthcare workers, protecting both them and their patients, and also those with underlying risk conditions.
But Rich, wouldn't it be good to also relate to the experience that you've had in the UK and you're having in the UK, vaccinating basically all the children, and in contrast to the other European countries? Perhaps you could say something about that.
I can certainly mention, I mean, a small number of countries have gone with vaccinating a wider range of children, and that has been shown to provide benefits not only to the children themselves, but by protecting them and reducing their risk of an infection, also providing broader population benefits in terms of reducing risk of influenza.
Adam, I think you wanted to add.
I think as far as pregnant women are concerned, I think a really strong information campaign is needed in this group. We are long way in influenza vaccination in risk groups in Poland nowadays, and pregnant women are fully paid. They don't pay for vaccination. We have free vaccination for pregnant women, and we have free vaccination in elderly plus 75. If you are 65 plus, you pay 50%, which is very low money a patient needs to pay for the vaccination. And what we noticed is that even it is free and nowadays fully accessible, the number of pregnant women has not increased who go into vaccination program. So the educational program is really needed in this particular group. I think in Eastern Europe, it is especially a very vivid problem because very few pregnant women are vaccinated in real life. So based on the EU policy, I think a really strong information program is needed for EU addressed for all the countries, especially Eastern Europe.
Stefan, can I bring you back in again there as well? You're hearing Adam saying we need strong EU messaging, particularly with regard to children and vaccination, because it's perhaps an overlooked group.
Yes, I just wanted to say something about that, because as part of our work to counter misinformation, the Commission will also be publishing an online course for teachers and also some comic books for children shortly. Even though this is not really the target group for flu vaccines in the Council recommendation, we think it is important to empower people with critical thinking from a young age. Also because then the children might be talking to their parents and grandparents. So we do aim a specific action on communication also at children.
I see we still have MEP Montserrat online. I don't know if she's still tuned in, but it seems she's still connected. Perhaps you would like to comment on what sort of messaging can be done at an EU level. Nope. Oh, I think the connection is gone. Sorry. Well, let's come back to this. I mean, we were always going to come on to this messaging question. And, you know, I want to talk about the messaging and the channels by which we deliver vaccination. Obviously, it's been a new experience for people around the COVID-19 vaccination, where we queued up in rather unpleasant scenarios with a lot of people and long queues and hastily put together premises. How important is it for these particularly vulnerable groups, be that elderly, be that those with underlying health conditions or children, to create an environment and a channel to get vaccinated that is confidence building? Ab, could I ask that of you?
Yeah, I think you have an important point there, of course. So people gathering at places where a lot of vulnerable people get together, we have to be very careful with that. And it depends a little bit on the country, because the organization is different in different countries. How to do that? I think a key function there is for the GP. So in principle, the general practitioner, he knows his patients, etc., to organize this, keeping in mind the different risk groups and their vulnerability. I think indeed, and the other message, of course, that we try to reiterate all the time is that it will be good indeed if you are vaccinated against COVID, that in the meantime you get yourself vaccinated against influenza. And we've just heard from the situation in Poland, which is true for many Eastern European countries, so to say, that the vaccination levels are too low, but also the system in which you can get access to vaccination. And we continue to talk about risk groups in Europe, which rightly so. And in the US, they tended to do the same thing at the beginning. And then they realized that about half of the people in the country are in the risk groups, and then they changed to a universal vaccination, which I think, as we have seen that for COVID, that has been the most effective way of combating the disease. So I think that it is important to organize that properly, to get GPs involved. Yeah, we have seen that during past pandemics as well, and so as much as possible get them involved and get it properly organized. And to give it a more generic recommendation for different countries is a little bit difficult because it's not organized in the same way everywhere. It's reimbursement, that's policies that are different, etc. So I think indeed you have to look country by country, but the most important thing indeed is to get the people vaccinated in a way that is safe, yeah, and will allow them to build up the proper immunity.
Well, I think the access is crucial. As Ab said, the problem is it's not only of recommendations, but also the ease of access. So Poland is a good example. We released possibility to be vaccinated in chemists last year. And the first vaccination that was provided by the chemists, we opened 2,000 vaccination points at chemists. And there were provided more than 2 million doses of COVID vaccine. And nowadays we are starting influenza vaccination in chemists. So if we think about risk groups, if there is a proper patient internet account system, this would be possible to retrieve patients at risk at the chemists to be first, and there could be, nowadays it is not, except COVID vaccine prescription, that this is systemic. You don't need to do anything to be qualified for vaccination and to provide vaccine. Nowadays, what we are trying to convince Polish government is to provide a systemic prescription for everyone in the system of internet patients' accounts. So this would be accessible in chemists, and the chemist could prescribe or not prescribe, just have the vaccine, qualify, and give a shot. This shortens the quite long way to be vaccinated. So the access is also crucial. And nowadays we are doing something about it in Poland. So probably we will be able to tell you in 2-3 years what happened and has it ever increased the number of vaccinated people. Anyway, chemists and the net of chemists is crucial, I think.
I think it varies hugely from country to country. I have experience of being offered flu vaccination in the places of work in some countries where it's a drive that happens every winter. And that leads me on to a question from Gary Finnegan, who's asking, when is the best time for people in risk groups to be vaccinated? And I'd also like to tie that to the idea of when is the best time for authorities to start thinking about procurement each year? Richard, can I put that to you?
Yeah, no, of course. So, I mean, in terms of getting vaccinated, the key thing really is to try to get vaccinated before flu starts to circulate. And that really, but also a time when flu vaccine becomes available. And we now have reached that point really. So many countries have now received their supplies of vaccine, which they've ordered earlier in the year. And of course, that comes back to the point of planning. So countries carefully need to plan their flu vaccine campaigns and order their flu vaccine several months ahead of the forthcoming flu season, ready for starting the campaign in Europe, in the Northern Hemisphere, in the autumn. And the campaigns really should start at this time, October, November time, before flu really starts getting sort of going and starting to circulate widely. But of course, it's never too late to get vaccinated. And equally, you know, if you're not going to get vaccinated until November or December or even January, there are still some benefits in getting vaccinated and protecting yourself. But clearly, if you can get vaccinated early in the season, you're then protected throughout the winter period. So I think those are the key messages, really.
Well, I think if I could say a single sentence, it's never too late for vaccination against flu.
And from this moment onward, it's never too early either. So because we see an upsurge at the moment of COVID, and so the risk groups are being invited in different countries now to be vaccinated. And I think when we look at countries like the Netherlands and Germany at the moment, so the uptake is not too high. And I think we should realize that it's definitely for COVID, but once you get vaccinated for COVID in the risk groups, it's for virtually the same risk groups get vaccinated against flu as well. So that's the main message, especially since in the background, what we have just talked about is the fact that if you get both infections at the same time, it may be devastating.
We have a very interesting question come in here. I see our MEP has already answered it in typing since she's not available via video camera anymore. We have a question. Do you believe the EU could procure flu vaccines in the same way that they did for COVID vaccines, meaning central procurement each year? I guess we're trying to build on some of the benefits, if you like, or the silver linings of COVID. Stefan, I'm going to read out what the MEP Dolores Montserrat has said, that at the European Parliament, they're working with the Commission to extend this practice of joint procurement that was effective for the COVID vaccines. But if we really want to build a European Union of health, we need more collaboration and coordination at EU level. And then the member states have the key role of facilitating it. Stefan, can I get your thoughts on that? Because it is and was a huge undertaking with COVID, but we see flu every year.
Yes, and indeed, this was, of course, a very new and interesting experience for everybody, this joint procurement of COVID-19 vaccines. And actually, I think it was a very successful European exercise. And we are now even talking about joint procurement of gas, for example. So inspiring was it for everybody. But one has to see also that, of course, it was a very special situation in which member states agreed to have joint procurement for the COVID-19 vaccines. It was a new pandemic. Vaccines were only under development when the decision was taken, whereas we have a different situation for flu. Which is long known. Also, the production of vaccines is ongoing for decades already. So therefore, it remains to be seen if member states will be interested in some joint procurement, also in the area of flu vaccines, and then we will see whether there's anything to be discussed.
But Stefan, this is of course a political issue, and we all know a pandemic situation is different from an epidemic situation. I fully agree with you that it would be fantastic if we would have a joint procurement, but we have seen how difficult it is anyway. And I should remind you that responsibility for public health, basically is at the national level. And and then how much money is going to be spent on what way of vaccination against influenza in the respective countries is still not at the policy level of the EU. That's the problem. But I fully agree with you that it would be fantastic if those political barriers could be taken away.
Well, I think it's important to say, of course, at this point, that industry has to be involved in this sort of discussion about procurement. And I know we have, from the steering group committee, we have Laurent Louet from Vaccines Europe. Laurent, perhaps you could add something on this question about timings of procurement, central procurement, and how we should think about that.
Yes, thank you, Jennifer. I hope you can all hear me well. I think it's a really, really good question, and I think, of course, it's only fair that people are actually asking this, because indeed, what we've seen for COVID was quite a success. But the first thing to maybe highlight is that for COVID-19 vaccine, it was a different kind of technique. It was what we call an advanced purchase agreement, not a joint procurement. So it was basically the Commission actually buying vaccines for the entire member state. So it's not the same as a joint procurement per se. Second, I think that when it comes to routine vaccines, such as influenza, but also others, I think the merits of joint procurement is clear for when there is serious cross-border health threats, and when we have seen as vaccine the COVID-19. But I think for the routine vaccination programs, I think that it's not the only silver bullet solution to access and to a higher coverage rate. I think that what we really want as well is to have more convenient access, as we have seen and already discussed before, and also as it was also mentioned by Stefan from the Commission, is indeed will all the member states apply to this technique of procurement for vaccines for influenza at the EU level? That's also up to their level to say. So I think that it's worth to have a discussion, and I agree that we need to have the Parliament, the Commission, and also the Council, well, basically everyone on the table to discuss that. But I'm glad we could tackle this, and thank you, Jen, for bringing me up. Thank you.
No problem at all. We never know. We might have more questions for you coming up as well. I'm conscious of time because I know you have to leave us to spread the word in the Netherlands. What would be your big takeaway for people listening in terms of those who maybe are involved in reaching out to vulnerable stakeholder groups? Because we have quite a few questions there regarding communication and spreading the message.
Yeah, I think communication is, of course, one of the major things. And so there are a lot of organizations. We have heard before about organizations taking care of people with asthma, with COPD, etc. But there are, I think, one of the major risk groups that we haven't specifically mentioned yet at the moment is the older adults, people over 60, over 65, and especially because also they have a lot of the comorbidities. When you're talking about diabetes, when you're talking about several of the other risks involved, and that includes the risk of a less functioning immune system. I think it's very important that to highlight that with the group of older adults in Europe. We have so many older adults, and those are absolutely the major risk group. So from that point of view, I think it's quite important to focus on that group as well, and especially since they overlap with a lot of the other risk group. So my main message of today, I want to reiterate that, is have yourself vaccinated against COVID and flu on the one hand, and then definitely in the risk groups. And if I had to single out one group, which I shouldn't do, I realize that, but if I had to do it, I would single out the older adults, because if you cover the older adults, you have the vast majority of people at risk. And then again, I would like to say also people taking care of older adults and healthcare workers more in general, that includes doctors, nurses, etc. They have, first of all, they have to set a good example, but also they should not harm their patients, as we said before. So my main message is get vaccinated against both. The older adults in Europe should be one of the prime targets, not forgetting all the other risk groups, but partly they're overlapping. And then definitely also the healthcare workers, on the one hand, to give the good example, but on the other hand, also not to spread the infection to their patients. Thank you.
Thank you, Ab. Very, very loud and clear message. As I mentioned, quite a few questions, Dr. George Castellanos and Patrick Swain, both asking about targeting communications. Now, Adam, I mentioned a couple of times, if you like, the silver lining of COVID pandemic and getting people to think about these and perhaps adopting other tools beyond vaccination to help us reduce the spread. However, vaccination hesitancy was around long before the COVID vaccine, but it perhaps got a boost, pun intended, with COVID. How do we counter, if you like, fake news, skepticism when it comes to flu vaccines and targeting those at-risk groups in particular?
Well, it's a long story of really powerful anti-vaccine or anti-systemic movements. And what in every country we have experienced very clear messages from these groups not to get vaccination against COVID-19, that you probably know very well. And in Poland, they were very strong and very loud for the last 2 years. Very interesting Nowadays, they are focused on the war in Ukraine, and they are really active against Ukrainian immigration in this part of Europe. Remember that Poland has received more than 4 million people from Ukraine since the war started. So what we are trying to do is to make a very precise message that vaccination has to be taken and the vaccination is safe. And both COVID-19 and influenza vaccination and others, this is part of healthy lifestyle. So the problem is that to convince people not to turn back to vaccination nowadays. In Poland, we have 60% of population vaccinated against COVID-19, which is very high compared to the influenza coverage. We have 79% of elderly vaccinated against COVID-19 compared to 25 as far as influenza is concerned. And what we are afraid nowadays is that even in elderly groups, people will not be so keen to be vaccinated with the fourth dose, the booster dose of against COVID-19. So there must be a very clear message from all groups, I mean regulators, organizations, medics, that vaccination has to be taken and it's safe.
Well, I think you've drawn a line there to show that it is other socioeconomic contexts as well in terms of getting the message across. Indeed, a vulnerable group could also be refugees or those fleeing war in particular as well. Stefan, what are you seeing in terms of, I know the Commission has a huge anti-disinformation campaign.
Yes, what we try to address is the key narratives in misinformation. Essentially, these are, first of all, that the disease is not so serious and the threat is exaggerated. Then secondly, that vaccines are not safe and or cause serious side effects. And thirdly, that vaccination is more about politics and financial incentives for pharmaceutical companies than health. And so we have to counter these three elements in our own messaging, and we have to be proactive on this. And indeed, so we have to stress that approximately 20% of the population gets infected with flu each year, and thousands may die. And then, of course, also that vaccination against seasonal flu is safe and can prevent severe illness. And that this is particularly important if you belong to a risk group and suffer from an underlying condition. And another element we need to stress as well is that vaccination against seasonal flu can also prevent you from contaminating vulnerable people around you with flu. So these are the key elements here, I would say.
Richard, are you seeing a difference in the way, if you like, skeptics or hesitant people, or even just vulnerable people who are perhaps vulnerable to this sort of messaging, in how they've approached COVID over recent years and how they approach the yearly annual flu vaccine?
Thanks, Jennifer. Yeah, no, it's an important question, and I think, as we've heard from some of the speakers, the situation really varies across the region in terms of what the impact of COVID and the COVID vaccine program has been on the flu vaccine programs. Some countries have seen quite a large increase in uptake in flu vaccine in their vulnerable populations. In others, it's been the opposite picture. But I mean, nonetheless, I think we need to come back to, we are now coming at a different phase of the pandemic. We're on the cusp of coming into the autumn and the winter. We're already seeing pretty intense, actually, COVID activity in many countries, seeing cases rising, hospitalization starting to climb. We don't know what to anticipate in terms of flu, but we do expect that that flu is likely to circulate. We don't quite know what the strains will be, but what we do know is that for both infections, really the key interventions here are to ensure that if you're in an eligible group, you make sure that you protect yourself and the vulnerable people around you by getting vaccinated. And the other key message really from WHO perspective is also to highlight that there are other things that we can all do as well to keep ourselves and vulnerable others safe too. So, and those reflect these wider messages around respiratory hygiene. So ensuring that we wash our hands regularly, that we catch our coughs and sneezes. If we're unwell, we don't mix with others, particularly if they're in vulnerable groups. And also consider wearing masks if we're going into crowded places, particularly if there's going to be vulnerable people there. All these things are going to be important as we come into the winter months. And this is all kind of captured really within WHO is today also launching our sort of flu awareness campaign, which has got a lot of materials linked to it to help reinforce that messaging. And this is part of our broader autumn-winter strategy for respiratory viruses.
Well, Laurent, perhaps I could bring you back in there again. Is there a role for industry in this sort of messaging as well, if we think that maybe some of the hesitancy actually centers around the pharmaceutical industry?
Thank you. Well, it's not an easy one, to be honest. I think that definitely, I think that industry has a role as well, indeed, in spreading the hard facts, the data we have as well. I mean, we have seen recently in the hearings at the European Parliament of the for the COVID committee that indeed some data were a little bit people were asking for data, and so I think that on our end we can only reiterate and come back to the data that's been submitted to the EMA or the TRIALS as well. But when it comes as well to the benefits, that's all I think what we can do as well. We can also support, I think, as well, the local communities, because that's really where the I think the real impact is when you can discuss with the local pharmacists or with the local some kind of leaders as well. But I mean, if the hesitancy is based on, if you want, anti establishment or anti-industry feeling, then we may have to be also careful and not to basically, actually even make the situation a little bit worse. So I think that right now the idea is indeed to stick to the facts and also to empower the local communities to really try to increase vaccination coverage rate as well in their communities. But, thank you.
Not a tricky situation you're in, Laurent. We appreciate it. Adam, you wanted to add something?
The industry situation is very delicate because it's very easy to make accusation of willingness to sell as much as possible of their products. So they are providers. On the other hand, industry has, I think, a very important role to provide honest information, first of all. And also, industry has financial resources to provide wide and very well prepared educational programs for the whole population about vaccination. Still, there is a majority of people who are not against vaccines, who are only hesitating what to do. They don't know what to do. So the clear messaging system has to be undertaken, and all measures that can be undertaken should be taken. And industry has a role in it too.
I think we talk a lot about vaccine hesitancy and vaccine skepticism, and we forget just boring old human apathy and laziness as well, which is something that has to be overcome. Before we move on to best practices or maybe success stories, a quick question, Adam, for you, very specifically. Why were chemists, or in particular, included in Poland? Or was it pharmacists in general? What was the thinking behind that move?
So what we have experienced during pandemics, it was overburden of general health system. And also it was related to GPs activities, because the access to GPs was limited during pandemics. Nowadays, the overburden of GPs is everyday life here. So the access to GP is not free, and it's limited. And we came to a conclusion that having a situation in Poland, we have around 100,000 chemists who are medics, who are well educated, who have knowledge, who have skills. And we have around 10,000 chemists in Poland. So we started a program with the chemist organizations to establish vaccination points for COVID-19 vaccination in chemists to ease the system. And what we experience here is the lack of professionals. We have to take into consideration, then taking into account the free work market in the EU, we have a lot of medics who have moved from Poland to Western Europe, for example, to UK, Germany, France. So we have lack of doctors. We have amazing lack of nurses and medics as general worker groups. So chemists are the group which is used not enough. They have a huge potential of educated medics that can vaccinate. And this is why we started educational programs for chemists to be prepared for vaccination. And as I said, 20% of chemist points are ready to be vaccination points, and they do it nowadays. So probably this is also a way to release or to decrease the overburden of GPs and other parts of healthcare system.
Thank you. Let's turn a little bit to the importance of a coordinated approach, best practice sharing. Stefan, I'd like to bring you in there to ask, what sort of role might there be at EU level to maybe assess what's working in the different EU countries, since they do all have quite different approaches? Is there a method where we can say this has been successful in terms of uptake, or this has been a more lackluster campaign, and perhaps share between countries what works, but from a point of view of a coordinated European approach?
Yes, absolutely, because indeed it is true that the different health systems are very different and the approaches are different. But for example, as we heard already during the COVID-19 pandemic, different member states and different regions have been developing new delivery methods for vaccinations to particular population groups, for example. Just think about vaccination buses also. Basically, we have been seeing that different practices have been developed. Some of them can certainly be called best practices. And one thing which we can do at EU level is help member states learning from each other. And we have already established a whole system for facilitating uptake of best practices which have been developed elsewhere by member states. And we can apply this method also to best practices to facilitate vaccine uptake quite clearly. And this is certainly something which we are going to do in the future.
Richard, I can't see your screen. I'll see if we can hear you. We can, great. What's your suggestion in terms of how important it is to monitor, to get statistics, to have the right comparable statistics from country to country in order to assess what's working and what's not working?
No, I mean, this is really key. So for countries themselves to understand where they are in terms of their recommendations and how well they're being implemented, having a high quality, timely monitoring system to monitor vaccine uptake is really essential. And then equally, at the international level, having comparable data is a very good way then for countries to benchmark themselves to see how they're doing, to potentially learn from each other in terms of success stories. I think there's all sorts of opportunities there when we compare and gather that data then at the EU and at the European level. So I think we've seen the benefits of that, certainly for COVID-19 vaccine uptake. And we should really try to learn from that now in terms of strengthening the flu vaccine uptake monitoring.
Well, you mentioned earlier looking at the South, the global South, and of course that's to see what's happening as they get their winter ahead of us. I mean, we've talked about this year. I mean, is this just cyclical, that is an automatic, or are we learning and changing what we're measuring each year?
No, I mean, flu is a seasonal infection. So there are we anticipate to see flu circulating in the Northern Hemisphere and in Europe each autumn and winter. And equally, it's a similar situation in the Southern Hemisphere. However, there are differences each year. We know that the flu virus mutates and changes each year. So that leads then to differences then in how the flu season may play out in terms of when the flu season starts, which groups are affected, the intensity of circulation. And of course, that creates a challenge for the industry in terms of the manufacture of flu vaccines and ensuring that the flu vaccines fit as well as possible to the viruses that may circulate the forthcoming winter. To us and the programs in terms of ensuring then that we get good uptake each year in those priority groups to make sure that they're as protected as possible.
Adam, perhaps you could come in as well and say something about the importance of this real world experience data sharing to really encourage best practices, and if you like, highlight what, the success stories, because there are areas where we can say, you said Poland, there's a huge increase in uptake of flu vaccine is possibly a good sign of a success story, even if you were starting from a low base.
I will start with the huge job that has taken place to prepare vaccines every season. And unfortunately, the situation is always to some extent unpredictable. Anyway, I think the real data that you have mentioned about the situation of vaccines and epidemiological and organization measures and so on, this is absolutely crucial that we have to have on-site here and now the diagnosis what's going on in particular country and in particular region of Europe and so on. So I think these are very important things to know what's going on and what are the key problems in local markets and local situation of healthcare system and vaccination programs and so on. What we have done here in Poland is a huge job to improve vaccination coverage of flu. This is more than 10 years since we started to improve situation. We were starting from extremely low vaccine uptake, and we are still far away of the goals. And I think I'd like to stress it that the educational programs and changing awareness of any health issue is a very long way. You can't change it in 1 or 2 years. You have to be prepared that the access to healthcare resources, including vaccines, and awareness of societies is a very long story. So every day, every year, we have to have a current diagnosis of what's going on here, and to establish short-term and long-term goals to improve the situation.
Stefan, we have a question in. It's asking what can be done to engage midwives as trusted advocates of vaccination. But I want to expand that and ask what sort of education initiatives might be needed for other stakeholders in general, including health professionals. But maybe, you know, we hear midwives, but perhaps other health professionals, perhaps teachers. Where do you think those sorts of information or education campaigns might be most effective?
Yes. So what I would like to mention here is that there are already a number of tools. For example, we have the European Vaccination Information Portal, which actually contains a wealth of information, including always an updated fact sheet on seasonal influenza, and that's available for everybody. But of course, we can do more. We know, for example, from the Students' Association in the Coalition for Vaccination that more content on vaccination, and that means both vaccinology but also communication, is needed in the curricula of medical students. Now, we have noted this. We are in discussions with member states there because obviously what is in the curricula of medical students is competence and responsibility of member states. And generally speaking, it's key to build up also health literacy in the public by means of continued consistent messaging on the importance of getting vaccinated. And something that has a particular importance in our social media times, where social media content can be viewed by billions of people, is that you always remember to pause before sharing something on social media and make sure it comes from a reliable source. Yeah, and I mentioned also the online course we are going to publish for teachers and the comic books for children, for example. So there are a lot of initiatives ongoing.
Well, I'd like to bring back in Susanna Palkinen to talk a little bit about some of those best practices. You shared with us those patient testimonials earlier. I'm assuming that's the sort of thing that you'd like to see being more widespread.
Yes, lovely. Thank you. I was conveying the message that for some of the vulnerable groups, it's essential to have the vaccination as part of your normal healthcare plan and not something separate. And best practice really is that if you are treating as a doctor or any healthcare professional, somebody with a chronic disease, that you are also taking this initiative for vaccination as part of that chronic care. I think is the most, from our experience, patients, they are listening when they are talking or receive messages from their healthcare professionals. They are the most trusted source time and time again. So that is really, really important. There is one best practice, or actually a corrective practice. For example, in Belgium, it used to be so that you needed to first go to your doctor to get a prescription for seasonal vaccination, then go to a pharmacy and get the vaccine, and then go back to get vaccinated. And that's really cumbersome and great burden on the healthcare system and disincentivizing for the vaccination. They changed that you could directly pick it up from the pharmacy and then go to your doctor. So any systems changes like that are extremely beneficial, and they are likely to raise the numbers in of vaccinated people. I don't know how much, but I anticipate a lot.
A lot is good, Suzanne. Adam, you wanted to...
Well, two practices that we have undertaken in Poland, and they were quite efficient, I think. Well, the health programs that are run by municipal authorities, the local authorities. They can provide vaccination programs. We have done hundreds of local programs that were free for people. And a lot of people were interested in this local health programs, including vaccination programs. And the other one is involving and encouraging employers to run vaccination in workplace. It is extremely important, not only for health workers. This is absolutely out of discussion that healthcare workers have to be vaccinated. But in general, employers are interested to have as much as possible workers at workplace during the season and to have healthy workers. So we started to cooperate with employer societies in Poland, and some of them, they are running programs at workplace, which is very easy because people don't lose time on vaccination. They are vaccination, they get vaccine at workplace.
As I say, overcoming the boredom or laziness factor.
Yeah.
As is often the way in these conversations, the provocative questions come right at the very end. I have a question, Richard, perhaps you can give your thoughts. Someone is suggesting, given that it would save money and resources if more people were vaccinated, should high-risk patients be rewarded, maybe being paid for getting their vaccine? We saw something like that in the US during COVID.
I think it's important to take a bit of a step back here and think around what's needed to ensure that we get good uptake and protect the vulnerable groups. And firstly, of course, the key thing is to have access to the vaccine. So it's important that governments make those decisions around sort of purchasing vaccines to ensure that they're available. And secondly, we obviously need strong systems then to actually deliver the vaccine. And we started to touch on that in terms of the different mechanisms in which vaccines can be potentially delivered to eligible groups, whether that's through primary care, through pharmacy settings, through occupational health programs. But the key thing here is ensuring it's that you've got systems in place that clearly make it straightforward for people who are eligible for vaccination to be vaccinated. And then, of course, that can also be helped by having strong systems in terms of call recall to ensure that people who are eligible for vaccination are called in for vaccination. And then finally, the other important component is having strong communication systems in place as well to highlight the benefits of vaccination around that they will provide in terms of their effectiveness and safety profile. So I think all those elements are really key to get the good uptake levels that are needed.
There's a lot of low-hanging fruit first before we resort to bribery, I think. Stefan, a question has come in. I would probably have liked to ask Ab this as well. Should the coalition on vaccination include more stakeholders? Are there any groups that you feel we could be reaching out to better?
Yeah, it might include more stakeholders. Who was it asking the question?
It was an anonymous attendee of our event.
Attendee. Well, I have to say, I don't know the particular conditions of participation, but usually we are as open as we can for such kind of stakeholder groups. So I would suggest to this attendee to just contact my colleagues who are in charge of this group. Can I use the opportunity to also mention that we are expecting in about half an hour at midday a joint statement of Commissioner Kyriakides, Regional Director Hans Kluge, and the Director of the ECDC, Andrea Ammon, on working together towards COVID-19 and seasonal influenza vaccinations for this winter. So I guess there will be some among us who might also find this joint statement and the launch of the initiative then afterwards interesting.
I'm sure we will all be keeping an eye on it, and indeed many of our audience will be following it, and I urge them all to use that hashtag EU Flu Day if they want to share it wider with their colleagues and with the wider world, because we've talked a lot on this discussion about messaging and getting the message out there and communication. And as we've said, one of the key ways and easy ways to do that these days is social media. We've just got a couple of minutes left. Adam and Richard, I'd like to give you the opportunity to give me a wrap-up thought. What, if you would like our audience to take away one key thing, would it be? Or if you'd one wish list, or if I had a magic wand I could wave that you would like to see for this winter? Adam, go first.
Well, increased awareness of flu and infectious diseases, communications, honest information. This is what has to be taken into account and undertaken to improve vaccination situation, especially in Eastern Europe.
Richard.
Oh, absolutely, and I agree with all those comments. And to add, yeah, just for all of us to be ready, to prepare for the winter to come, to think carefully of what we can do to protect ourselves and others. And if you're in a vulnerable group, an eligible group, take up the offer of vaccination for flu, and also make sure that you're protected against COVID-19 as well.
And Stefan, any final message from you other than tune in to see what's being said at midday?
Yeah, everything has been said already. I can just join the others. It's clear that easily accessible, appealing vaccination services and clear targeted communication at local level are key.
Well, thank you very much. Thank you to all our panelists, and as well to the various members of the steering committee group who joined and listened in and all of that. I know we had so many questions coming in. We've got various comments there in the Q&A as well, but I hope we've addressed the vast majority of those points over the last hour and a half. It's an ongoing campaign. So as I say, once again, use that hashtag, spread the message. And remember, this webinar has been recorded and you will be able to see it on the steering group website in the coming days. So if you missed anything or want to go back and check anything out, you can do that. And of course, you can always direct your colleagues or your friends or those other interested parties to have a look at what's been said here today as well. And of course, you can do your own bit by telling your family to go out and get their jab as well. We're talking about healthcare through vaccination. We want to be focusing on that, not illness care because you didn't get the vaccine this winter. So thank you all for joining in, and please keep an eye on the website for future events and have a great day.